Welcome, my name is Chase Elsick. I chose to do my report over osteosarcoma. My inspiration came from Freddie Joe Steinmark, a 22-year-old UT Longhorn player who was diagnosed on December 8, 1969, with osteosarcoma in his thigh. On December 12th, 4 days later, they amputated his leg at the hip. Freddie was lucky enough to survive a year and a half before dying on June 6, 1971. During my research, and while finalizing this report, I stumbled on another player that inspired me. His name was Cam Brown. Cam Brown is a player from Florida High School who found out on May 7, 2017, just before high school graduation, that he had osteosarcoma in his left shin. Cam had this left leg amputated on June 29, 2017. Wow, he kept a positive attitude even though he had accepted a scholarship to play football for South Carolina. Cam was determined to be the first college player with a prosthetic leg. Cam tragically lost his battle to osteosarcoma as the cancer had spread to his hips, spine, upper back, and more. Cam died as I wrote this report. He died November 7, 2017. And to understand osteosarcoma, let's start to see how it begins.
The skeletal system serves as the framework for the body and also protects the internal organs. Bones grow by a process called remodeling. During remodeling, bone cells called osteoclasts eat away or resorb bone tissue. Osteoblasts, another type of bone cell, add new bone to the holes created by the osteoclasts. Osteosarcoma is a type of bone cancer that occurs when osteoblasts mutate into cancerous cells. These cancerous cells continue to divide at an increasing rate, forming a tumor. Tumors usually develop in the growth plate or metaphysis, the wide section of the bone that grows during childhood. Osteosarcoma can develop in any bone of the body. However, it is more likely to develop in the femur, tibia, and humerus. The most common symptoms of osteosarcoma are pain and swelling at the tumor site. Osteosarcoma usually affects patients between the ages of 10 and 20 during the adolescent growth spurt. Males and African Americans are more likely to develop osteosarcoma. A history of radiation therapy or having certain genetic factors also increases risk. Treatment usually involves chemotherapy and surgery.
Now that we know what osteosarcoma is, we can understand why young growing athletes might have a low success rate for the treatment of this type of cancer. As they call to push through pain and swelling is a routine occurrence in athletes, this at-risk age group will often find athletes ignoring the warning signs of this cancer, allowing it to grow, metastasize to organs or other bone structures, making treatment options diminish. This explains why Cam Brown and Freddie Steinmark died within months of their diagnosis. Let's discuss treatment options. Treatment options vary and are based mainly upon early diagnosis. The best prognosis is with the proton therapy, which I will describe in a moment. Once the cancer has spread, radiation and chemotherapy are often used in a combination to treat the spreading cancer. Radiation involves exposure to large doses of radiation, which exposes both healthy and the cancer cells to toxic cell-killing radiation. Chemotherapy is given through the blood and also involves the entire body being exposed, both healthy tissue and unhealthy cancerous tissue, without the ability to target only the cancerous tissue. Proton therapy, a 30-foot tall, 100-ton machine that rotates 360 degrees around the patient to enable precise positioning of the proton beam to the tumor. The benefit of the proton beam is that they do not pass through the tumor. They can actually measure the exact size and shape of the tumor. The proton therapy approach allows the precise targeting of treatment without exposing healthy tissue and organs to radiation or harmful damage. A physician can treat a tumor in a targeted way. In 1 week, that would take 4 months of radiation and chemotherapy and not damage other healthy tissue. This is very beneficial to children and other where sides may be concerned. It also beneficial because this cancer is so aggressive.